I'm Dr. Art Mollen. Welcome to Hope You're Feeling Good. I've practiced medicine for over 50 years and seen the face of medicine go through a complete metamorphosis. Physicians have more diagnostic options and tools, however, less time to personalize patient care. The healthcare landscape has become more difficult to navigate, so you'll need more information to advocate for yourself. I'm here to answer your questions as well as educate you with the latest breakthroughs in medicine. At the end of the day, I hope you're motivated to take better care of your health. I'm Dr. Art Mollen, and I hope you're feeling good, and if you're not, I'm going to get you there. But first, here's what's on my mind. If you drink any type of fluids on a regular basis, they probably have more salt in them than you realize. A lot of foods have salt, and the problem with salt is that if you have high blood pressure or heart disease, then you're going to have a problem because it helps to retain fluid. So what you want to do is try to reduce the amount of sodium in your diet. Most Americans consume approximately 3,000 milligrams of sodium a day, yet the American Heart Association suggests that you consume only about 1,500 milligrams if you want to lower your blood pressure and prevent heart disease. So what can you do with the sodium that you're taking in? Well, of course, your doctor may put you on a blood pressure medication. They may also put you on a diuretic medication to get the salt out of your body. But the problem with that, there are a lot of side effects. So what you ought to do is just watch the amount of sodium in the foods that you're eating. For instance, if you had a cup of cottage cheese, you might not realize it has 1,100 milligrams of sodium. If you had some potato chips, one serving is 170 milligrams. And a cup of soup, well, you can have up to 800 milligrams of sodium in that one cup of soup. So there's a lot of hidden sources of sodium in your diet. So what you want to try to do, again, is reduce the amount of sodium in your diet because it's going to lower your blood pressure without even taking medication. So that's the first thing you should do when you have high blood pressure or even heart disease. Next, what's on my mind, there's a new medication. It's an antidepressant. It's called an agonist. It's an agonist, and that sounds like a big word, and it probably is. So an explanation for you is something that you ought to know. There's a lot of medications that help depression, SSRIs, selective serotonin reuptake inhibitors. But this new medication called Auvelity. That's Auvelity. It's a tough one to spell, so we're going to spell it out for you so you can see. The medication won't be available till the end of the year, but it's a very fast-acting medication. So when you're taking some of the other antidepressants, they may take 4 to 6 weeks to work. This one, in the clinical trials, it's been suggested it can work in 1 week to help reduce your depression, as well as reduce your anxiety. So it may be something that you want to consider looking forward. Again, it's a new class of medication. The medication combines two drugs that are already out there. One is dextromethorphan. Dextromethorphan is actually something that's in, you probably heard of Robitussin, a cough medication. DM, well, DM is a dextromethorphan. The other component is something called bupropion. Bupropion is a medication also generically called Wellbutrin. Well, Wellbutrin is an antidepressant that's been used for years. Well, they combine the two of these, and it seems to have that effect that within 1 week, you can potentially have a relief of your depression and your anxiety. So that's something you might want to consider. The next thing that's on my mind is taking medications that are prescribed by your doctor. Well, most people don't take those medications for the entire amount of time that they've been prescribed. In fact, a recent study out of the Center for Disease Control suggested that only 50% of the people actually take these medications the entire time that they're prescribed. So, for instance, a medication may be prescribed for blood pressure. So the patient lowers their blood pressure. They come back into my office and they say, well, I've been taking the medication, doc, for the last 30 days and it seems to be okay. So I stopped the medication. No, that's not the way these medications work. These medications are something, when you're taking medication for high blood pressure, it has to be taken on a regular basis. You have to continually take it until maybe you've changed your diet and lowered your sodium, as I talked about, or just basically started exercising and lost some weight, which also is going to help. But certainly medications must be taken. The other thing is expiration date on medications. It's interesting because medications will expire maybe in 1 year or 2 years. Well, a recent study from psychopharmacology suggested that 90% of these medications can actually continue to be taken for up to 15 years. 15 years, that's incredible. But there's certain medications you can't take past the expired dedication that's on the prescription. Those are nitroglycerin. That's one that you might want to be careful of. Any other heart medications, any blood pressure medications, any eye drops, they have a tendency to expire and you don't want to take a chance with that. And the other thing is insulin for diabetes. So if that expires, then you don't want to take that. But most of the other medications you probably could take. My final suggestion on all of those medications that you're prescribed, just listen to your doctor. Take them for the period of time that they're prescribed. I think that's the most important thing, and that's what's on my mind. So I have questions today from a lot of our listeners and viewers. The first one is from Donna, and Donna's 35 years old, and she wants to know whether or not she can get the COVID booster shot. The only problem with Donna is she has not received the original COVID shots. So for Donna, basically, you cannot get the COVID booster. So the COVID booster is only indicated for people who have actually received the previous immunizations. Now, the COVID booster is a little bit different than the other shots. It's a bivalent vaccine. That means it has two components. The two components target the Omicron BA4 and the BA5. Now, about 90% of the cases out there are the BA5, so it will protect against that for serious hospitalizations. It'll protect you about 90% from being hospitalized, about 70% from actually contracting COVID. So for Donna, you're going to have to get the first series before you can ever qualify for getting the booster shot. So unfortunately, the booster shot is not going to be for you, but for other people out there, you ought to get the COVID booster if you've previously been immunized, because we don't know how the COVID is so ubiquitous right now, and it's still out there. So you don't want to get COVID. Even if you've had COVID before, you can still get COVID. So my next question comes from Monica. And Monica's been getting hives off and on for the last several months. Chronic hives usually occur if you've been having them for over a 6-week period. Now, a lot of people get hives, and they may be allergic to a particular food. They may be allergic to pollen. They may get these welts on their body because they were out in the garden, or maybe they were exposed to poison ivy or something like that. But when you get hives on a regular basis for more than a 6-week period, that becomes much more concerning. So you probably gone to an allergist, you've gone to a dermatologist, maybe no one's coming up with a specific reason that you've actually had the hives. So what I would suggest in that case is you probably want to see an internist. The internist maybe can order a CAT scan of the chest, a CAT scan of the abdomen. Just let's find out if you have some blood tests that are abnormal. When people have chronic hives, I look for underlying liver problems, problems with their pancreas. Again, depending upon your age, there can be other causes of those hives occurring on a regular basis. A lot of times with hives, we often use corticosteroids. So the first treatment for it would be to use some Benadryl over the counter, or Claritin, which is a non-sedating antihistamine. You can use that. The next would be a prescription from your doctor. They would prescribe a steroid for you. And then finally, you might want to see a rheumatologist, because the rheumatologist could prescribe what's called immune modulating drugs. Those drugs include drugs that you've probably heard of, like Humira, Enbrel, Remicade. These are immune modulating drugs, and they affect your immune system. They make you a little more prone to getting an infection, but the other side of the coin, they can help with those chronic hives. So I think what's most concerning is to find out what the underlying cause is. Is it a new medication that you've been taking? Is it a new perfume, a new deodorant that you're using. All of those things can potentially cause the chronic hives. So that is a potential problem. So in my next call, and we'll see who that's coming in from, it looks like it's from Travis. And Travis is planning to take a trip to South Africa. So he wants to know what type of immunizations he should get and actually where he can get those immunizations. So Travis, here's the situation with going to South Africa. There are a lot of different immunizations you're going to need. You're going to need, first of all, probably a yellow fever immunization. You may need a typhoid immunization. You should get immunized for hepatitis A and hepatitis B. That's particularly important. Another one is rabies. There's a lot of dogs that carry rabies, and if you get bitten, that's going to be a real concern for you. But the most common problem with going to South Africa or even some of these other countries, Kenya, is malaria. So you're going to want to get a drug. It's called Malarone. Well, Malarone is a prescription medication which will prevent you from getting malaria. And malaria is a serious condition. It's caused by the Anopheles mosquito, and those mosquitoes are prolific when you travel to South Africa. So you have to take this Malarone medication. You have to actually take it several days before you leave, and then you have to take it for a week later once you've returned in order to prevent getting malaria. So one of the places you can go to get these immunizations is called Passport Health. Now, Passport Health is the leading travel immunization company in the United States and in Canada. They have multiple locations. You can go to their website, and then that will tell you the location that's nearest you. They have over 200 locations throughout the United States, and they will prescribe for you the medications that you can actually take with you if you were to get sick. So you may need antibiotics as well to take with you, some Imodium, some other medications for diarrhea, nausea, vomiting. Antibiotics are often important too. But they'll give you the immunizations that you need, and they'll tell you about that travel destination that you're going to, and they'll be able to determine exactly all the immunizations. And then if you need a booster immunization, they actually will give you that as well. So my recommendation is to go to Passport Health, travel immunizations, and they have their website, and that will give you all the information you need. Have a safe trip. Well, welcome to Family Medicine. And if you are a physician, you know that if you have a family, you're always getting calls from them. So I have a call coming in from Paige. Hello.
Hi, Dr. Art.
Paige?
Do you recognize my voice?
It's my wife, Paige. Hi, yes. How are you?
Good. I tried to catch you this morning, but I think you were probably on the second leg of your daily triathlon, and then I tried to call you and didn't hear from you, so I thought I'd call in because I have a legit medical question today.
What's your medical question today, Paige?
So I woke up this morning and I couldn't turn my neck to the right. So my neck hurts. I don't have full range of motion and movement in it, only when I turn it to the one side. And I also feel like pain radiating down into my shoulder blade a little bit too.
So when you have that type of pain in the neck, and again, it's usually precipitated by something you might have done. And I remember yesterday you were running on the treadmill and you had an elevation to the treadmill, and you were like holding on and still trying to run at 6 miles an hour. So I'm sure that probably precipitated some of that pain. So usually when you have that pain in the neck and it's on one side and it's radiating between your shoulder blades, it's usually caused by a slight impingement of a nerve, usually at the C5, C6 level in your neck area, and that puts pressure on that nerve, and that can radiate usually right between your shoulder blades. That's quite common. Usually what I suggest for it is something like Voltaren cream or gel. You can get that over the counter, and you rub it on there. It's an anti-inflammatory. You can take ibuprofen. That helps. If it becomes more chronic, then you want to get a cervical traction device, and that'll pull up on your neck and kind of open up the disc spaces. I like simple measures for that. I don't think it's anything that's going to be necessarily recurrent or give you any chronic pain. How is it feeling right now?
I can't turn it all the way to the right very well.
Yeah.
It's, yeah. It's not excruciating, but I wonder if I'm going to be able to, when can I work out again? Am I going to aggravate it?
Sure. So basically, you can continue to work out. The only thing I'd suggest is that you not elevate the treadmill and not holding onto the treadmill at an elevation while you're running. That's going to aggravate that type of condition. So I think you can do other exercises. You can swim. You could bike. You can continue to do other exercises, but just be careful of the treadmill for right now. And your pain should be ameliorated in a matter of a few days by just taking some ibuprofen over the counter. So I'm sorry that we weren't able to connect early this morning, that I ran out the door to get my exercise.
So before we go, can I ask you about dinner? Given my condition, is cooking in the future? Do I have to cook?
Well, I'll give you the day off of cooking tonight. No, I'll take you out for dinner now.
You're the best. Thank you.
All right.
Medical advice and dinner. I love it.
All right. Love you. Okay.
I love you.
That was my wife, Paige, with Family Medicine. And I think I have a phone call coming in right now from my sister, Francine.
Any suggestions for me as I get ready for bed? My legs and knees down to my feet feel weird. Skin feels tight over the feet. Legs ache. Ankles feel pain. The only relief I get is to walk around, and I can't do that all night.
So when you're having a certain amount of numbness and tightness in your ankles and in your feet, and if this has been a chronic condition, it generally is caused by spinal stenosis. Spinal stenosis is basically when you have your spinal cord and you have a certain amount of tightness and actually restriction in that cord towards the base. So a lot of times these situations are treated with anti-inflammatories. So she could take ibuprofen over the counter. There are prescription medications, meloxicam. That's a medication that could be prescribed. That's something that works quite well. Sometimes they give you epidural injections just to reduce the inflammation in that area. I like epidurals, but usually it's a temporary relief. So it's not going to treat the condition on a regular basis. It's only going to give you relief maybe for a 2 to 4 week period. And then you might be right back where you started. So some type of stretching exercise, even traction, can certainly help with the spinal stenosis. You're going to need to get an MRI just to see if there's any other underlying conditions, make sure there's no tumors or anything like that in that spinal cord. So I think when you have a condition of a spinal stenosis, you can take medications. Some of the medications they're using now are anti-Parkinson drugs. One is called Sinemet, and a lot of patients suggest that that's helped them. One of the previous medications that has been used rather ubiquitously over the last decade or so is one of these medications that help to change the psychopathic route of the pain that you may be having. It's called gabapentin. And gabapentin, it's been around for quite some time. Neurontin is the trade name for the drug. And this helps to change your whole perception of how you experience the pain. The problem is a lot of people get very tired when they're taking it. They seem to have an increased amount of sleep. There are a lot of problems with taking those medications and the side effects. So I don't like those necessarily. If you want to try something newer, some of the neurologists, as I said, use this Sinemet. But long term, you have to find out what the condition is and get the MRI of that lumbar spine. But that tightness in the legs and the numbness in the feet, it's usually being caused by more of a spinal stenosis than anything else. So that's my sister. And the next question is from Samantha, my daughter. It's about my grandson who's just turned 5 years old, and they want to know exactly what she can do for the fever that he's had for the last 5 days. He's had a fever of about 101. So she took him to the doctor. They tested him for influenza. The influenza was positive. They said that he can take, some Tylenol, but he did not need any antibiotics. But she's concerned what she can do for the fever. So usually these children get dehydrated very quickly. So you have to increase the amount of fluids. You have to really push them to drink any type of fluids, whether it's Sprite, whether it's water, whether it's Gatorade, whether it's Pedialyte. All of those can help to hydrate a 5-year-old. And again, I don't think they necessarily need antibiotics. And when they've tested positive for influenza, well, that's a time that, again, you should be giving them, these fluids and Tylenol on a regular basis. I don't suggest, giving them the ibuprofen. I don't like that for the children as much as I simply like the Tylenol. There are conditions that have been associated with giving children aspirin, so you want to stay away from aspirin when you have children, particularly in that age category under the age of 10. So I would prefer just Tylenol and increase the fluids. That should help, and if it persists, then we want to do some blood tests. And that's family medicine. And now I'm going to give you my final tip of the day. I want to talk about smoothies. Everybody thinks that smoothies are the panacea of health. They think it's a cure for just about every disease that you can think of. And if you go in, they throw all kinds of ingredients in it. There's whey protein. There's all kinds of vitamins and mixtures and things like that that they put into these smoothies. But what they don't tell you about is some of these smoothies have over 1,000 calories. If you get those ones with the peanut butter, and I like peanut butter, but some of them really are loaded with calories. Now, smoothies may have some nutrients, so let's not, denigrate smoothies altogether. They are good for you, but don't think about taking a smoothie along with your sandwich for the day. If you decide you want to have a smoothie, let that be your meal for the day. Let that be your lunch. Smoothies that have more fiber in it would be the ones that contain the spinach, contain the celery, contain the carrots, the veggie smoothies without all the other ingredients that are high in calories. So smoothies may be good for some people who maybe want to gain some weight, and for other people who necessarily might have, some lack of nutrients and need more protein. But for most people, smoothies should be taken in once in a while, but not on a regular basis. And that's your tip of the day. I'm Dr. Art Mollen, and I hope you're feeling good.